The new patient experience at Wellspring Dental is really important to us. We want to make sure patients feel comfortable and at ease, and that they feel like it's a safe space to talk about their healthcare. For a patient initially, we want to get information from them about their goals and their health questionnaires, and we want to make sure that we feel like that we can help these patients and make sure that we're a good fit. So it's important to us for patients to have a goal. There's any number of things that we could focus on, and you know your body best, and we want to make sure that we're targeting our efforts to the things that are going to make the most impact for your day-to-day. And the diagnostics that we might go through, for sure this will be evolving over time, and it'll be patient specific, but in general, we're going to look at a CBCT image. What that is cone beam technology looking at a 3D image of the head and neck area. That gives us a big picture view of the bone, the teeth, the jaws, and the airway, as well as the surrounding structures. So we can kind of screen if we need to involve any other healthcare providers. We're also going to be doing intraoral x-rays. Those are the type that are going to be able to tell us more about periodontal disease and cavity risk. We're going to do photographs, and we're going to do measurements of the gums, take your health history, do an oral cancer screening. Sometimes we'll do an iodine skin test and analysis of the microbes in your mouth by looking at a saliva sample under a microscope. We want to check the pH of your mouth to understand if we are in an acidic state. We want to do an initial bite analysis, a joint and muscle exam, and we want to look at if we want to involve additional information for sleep screening and referrals if necessary. So that might involve looking at biocompatibility with another provider, getting some vitamin D levels, or doing some kind of sleep screening or sleep study. So at our initial visit, we're going to do a series of diagnostic information to get to know you better and understand your current state. And based on that information, we may recommend some additional testing like biocompatibility, vitamin D, or sleep testing. And once we have all of that, then we're going to come together to determine what's going to be right for you. That initial visit, we're going to expect to take about 2 hours. And we may or may not have a plan that same day, depending if we want some additional testing and depending on your needs. We're going to do some initial diagnostics looking at CBCT imaging, which is a 3D image, intraoral x-rays checking for cavities and bone levels, take some dental photographs, measurements of the gums, health history, oral cancer screening, and we're going to look at a saliva sample under a microscope to see what kind of microbes are there, pH testing, an initial bite analysis, a joint and muscle exam, measuring tethered oral tissues. And then based on that information, we may want some additional testing that would happen at a separate visit. We might refer for biocompatibility testing, vitamin D blood work, sleep study, or we might want to get mounted models to do a more detailed analysis of your bite. That first visit may take about 2 hours, and depending on the complexity of the needs, we may have a plan that same visit, or we might order those additional testing or refer for additional information, and then meet again for a review of records so that we can review your needs in more detail. Our goal at Wellspring Dental is to offer comprehensive care, and this new patient process is crucial in that effort. What our goal is to be able to look at all this information and partner with patients and earn their trust to go through this process so that we can do our best work. The more information that we have about a patient, the more detailed our recommendations can be, and the more impact that we can have on their health. And of course, we want to meet patients where they are. So patients, while we go through this process and we go through a co-discovery process of your current condition and where we might want to go, it doesn't all have to happen at one time. So what I love to do is make sure that we kind of have a map and we can go through that journey at whatever pace is comfortable for a patient. We can separate that out into phases so that we are making progress over time.